patients truly at the center of care? And I think this is the most important question we who are privileged to run our own establishments need to constantly ask ourselves. Are we placing the patient, in this case at Fernandez, we deal with pregnancy, that's 85% of our work. Do we put the mother and the baby at the center of all our decisions? Do we hear the woman's voice? And this is a hard question, and we always need to ask. Now look at this birthing room. Does this show that we care? Imagine women birthing in this environment. There's absolutely no respect for cleanliness, nothing. So it's not surprising when the White Ribbon Alliance in 2018 started a campaign, and they had just one profound question. What is it that women in India want? And they asked about 150,000 women across 24 districts. And the aim was to amplify these voices, and hopefully this would change the quality of care. It was called My Health, My Voice campaign. And there was a clear questionnaire women actually wrote down. And 2 out of every 10 women asked for dignity and respect. And just see what they asked for. 1 bed in hospitals with large volumes and not enough infrastructure. It's quite traumatic to see what women go through. They want a clean toilet, a clean labor room, respectful behavior by the doctor. So now at the end of the campaign, do we want to know what women want? You'll be surprised. Kindness, respect, information. Even the poorest woman has a right to know what you as a doctor are going to do for her. And why is it you advise whatever you are advising her? They want to know that whether you're going to have medications available, or do they have to run to their outside shop and buy everything when everything is supposed to be free? Can they have a birth companion? It's a woman's basic human right, not to birth alone, but to have a companion of her choice. And sadly, 70% of our mothers across our country birth alone among strangers. Can you imagine the fear that women experience? And we know today that women should be given the freedom to move, because when you have a woman in the upright position walking around during labor, gravity helps the descent of the baby down. It cuts short her time of labor and facilitates normal birth. But yet we continue to train in very archaic practices which have no scientific basis. And we have women lying in bed for hours during labor, not encouraged to work, to move around. These voices went global. So globally, the movement amplified to 114 countries and became a very strong voice in 2019. Women said, we have to stop this disrespect and abuse. WHO said, every woman has the right to the highest attainable standard. And I draw your attention to dignified, respectful care during pregnancy and childbirth.